By way of update, so on the evening of Monday, February 24th, a woman in her 60s presented at Sunnybrook Health Sciences Center's emergency department. As I've stated before, it's not surprising to learn of this news, as we have a very mobile population with a lot of international travel. So it's quite likely that we will continue to see more people presenting with symptoms and a travel history to affected areas in the world. This newly diagnosed person has a recent history of travel to Iran, and she became unwell after arriving in Toronto. At that time, her symptoms included a cough, sore throat, body aches, and occasional fever. So upon presenting to the hospital's emergency department, a thorough medical assessment was completed and COVID-19 testing was initiated. She was then discharged and is presently at home in self-isolation. 2 members of this individual's family are also in self-isolation, currently in self-isolation at home. So I can tell you that at this time, Toronto Public Health staff are following up with this person and their close contacts. As you know, and as we've spoken in the past, we do this to monitor the person's symptoms, and we do our contact management in order to notify others that they may have been exposed to a potential health risk. We do this in order to protect population health, to prevent the spread of infectious diseases in our community, and to ensure that those who have an infection are well taken care of and well managed. At this time, the virus is not circulating locally. However, we do know that there is some global activity happening and global transmission. So with this in mind, we are actively working with our city partners, our provincial partners, and other health partners to plan for the potential for local spread. We are continuing to carefully monitor the situation, and I think at this time it's very important that residents of Toronto, and I would argue beyond, should stay informed by regularly reviewing and accessing credible sources of information. I can't emphasize enough, as I have in the past, that the best things that people can do, our current advice continues to be around all the usual good practices in cold and flu season. Things like washing your hands or using an alcohol-based hand sanitizer if hand washing facilities are not available. Trying not to touch one's face with one's hands. Covering your cough or sneeze, ideally with a tissue, or using your elbow or sleeve if a tissue isn't available. And of course, staying home if you're sick. With respect to staying updated, I will tell you that at Toronto Public Health, we are continually updating our website at all times as new information comes in. Toronto.ca/coronavirus is the place to look for information and to stay informed in respect of what is happening. We also, as I've said before, are running a hotline at 416-338-7600, and that hotline is available Monday to Friday from 8:30 in the morning to 8 o'clock at night, and on the weekends, Saturday and Sunday, from 10 to 6, so that people can ask their questions and have them addressed in an informed and credible manner. So with that, I'm going to turn it back to Dr. Williams, and we'll take questions thereafter.
Okay, well, thank you. And on the updates, I'm not going to read out all the numbers because you have access to those there on the global picture. More of the interesting points in that is that we've seen with the numbers in China where they bounced up large numbers. They only went up by a little bit, a couple of thousand. So that number is slowing down, so that's encouraging. We continue to see signs of that aspect in China, both in Hubei and throughout abating. But early, we're still monitoring, still watching. One of our scientists from Health Canada or from FAC is there reviewing the situation, monitoring a number of questions and issues on that regard, and keeping us informed. as to what they have learned, what they're learning as they do more of their, I would say, clearing up and doing residual aspects related to their issues in China. Out of that, of course, you've seen some other countries that are moving up fairly quickly, such as Italy and South Korea, as they've dealt with the impact of the virus in their jurisdictions, as they seek to understand that not only with cases but with deaths as well. With that in mind, the Special Advisory Committee, or our Federal Provincial Territorial Group, we've looked at it and we've decided we've changed our countries of interest and concern. So we've updated it so that those now include 7 places, which is China still, and Japan, Hong Kong, Italy, Iran, Singapore, and South Korea. So we're doing that, and we will continue to do that as we see new areas or hotspots of concern that we would want to have as part of our investigation of people who would be of interest to investigate and put on our list of people under investigation, much like the case that Toronto's dealing with at this time now. So that's part of the dynamic process as we undertake to do that. As far as our Ontario numbers, we continue to have a number of tests submitted each day in there, and we've done over 629 samples, of which 610 are negative, 14 are pending, and we now have the confirmed positive. Presumptive, we're still working some things with the lab terminology, but in the future we hope to be able to say that our positives at Public Health Laboratory do not need to be confirmed with NML, but we're just trying to get the timing of that right and the terminology correct. So we have the 2, the one we talked about earlier in the week, and the new one that we're talking about today. And we have our 3 resolved cases in that line there. So other good news is that Trenton, Cohort 2, were released yesterday. And so that's good news. And all those, even though the number were tested at different times for various signs and symptoms of respiratory issues, all negative. And the same thing is that our NAV-CAN Center now, which is moving along, they have all continued to be negative, and we continue to monitor their situation as that process completes its phases in there as well. So that's good news in that regard. So overall, what we're doing now, as we say, we're into this aspect. I talked about the third 14-week period as we see these other sites coming about, assessing which ones are of concern, what is the status from WHO's perspective on how well they are undertaking doing their own investigations, much like we had questions with China and their data and information. How does that inform us? And we get informed. That informs Toronto Public Health as we share back and forth and be consistent in how we respond across Canada. We've heard aspects around the Chief Public Health Officer of Canada saying we have to be continually prepared for the pandemic type aspect. We have been preparing since day one. That's part of our pandemic response. We always open it up. We always start to deal with it. We ramp up and we ramp down. We don't just turn it on and off. So this is another phase of our response as we do that. And what's the next things we're going to be adding? And we hope to be updating you on that as we continue to prepare and be prepared as part of our process, which we've done before, whether it's Ebola, H1N1, and learn from the lessons of SARS in the past. Our risk still to Ontarians is low. And we're still in the containment aspect of that aspect of the overall management of a pandemic. And so we will continue to proceed on that basis. And we'll be waiting for more further investigations from Toronto Public Health and inform us in that regard and monitor that. So that's our situation.